Hi friends, good evening. I'm Dr. Ashutosh Gupta, and today we're going to talk about heparin-induced thrombocytopenia, which we call as an HIT. ओके सो अनफ्रैक्शनेटेड हेपेरिन जो हम काफ़ी साल पहले इस्तेमाल करते थे, वो एक बड़ा मॉलिक्यूल होता है। और चूंकि वो इतना बड़ा स्कैफोल्ड होता है, तो वो प्लेटलेट्स को अपने अंदर उसको स्कैफोल्ड करके उसको बंद कर लेता है प्लेटलेट्स को, एंड देयरफॉर because of the mass effect also we can have an heparin induced thrombocytopenia, but mostly it is idiosyncratic reaction. Idiosyncratic meaning thereby कि वो एक सेंसिटिविटी एलर्जिक रिएक्शन, idiosyncratic रिएक्शन एक होती है, राइट? एंड जैसे पेनिसिलिन के लिए रिएक्शन होती है, राइट? But for the last decade or so, we are not using unfractionated heparin. And we are talking about pregnant females and pregnancy, right? So what we are using is a low molecular weight heparin, and so we can have an enoxaparins and clexanes of the world and all those stuff. And then what we have understood and identified in general sense that in 5% of the unfractionated heparin we can have this heparin-induced thrombocytopenia, but this is supposedly very rare. This phenomenon of an heparin-induced thrombocytopenia is very rare, only associated with the LMWH or low molecular weight heparin. The incidence could be from zero point 0.1 to something around 1%, right? But we encountered one case very recently regarding all these things. So let us first see these slides, and then probably we'll talk about how we can really turn the things around. This is a lady who had come to us, है ना? Now we are seeing कि 1100 ग्राम का बेबी है. So you see that we are dealing with a severe IUGR baby. Okay, लेकिन इस बात को ध्यान दीजिए कि जब हमने अपनी जर्नी शुरू करी थी, this was the second time that she is coming to us. So all the biometry was at 50th centile. जैसे BPD, HC, AC, FL जो भी fetal parameters होते हैं. So we started our journey from 50th centile. Now we are getting this IUGR baby, right? Okay, so all these things are less than fifth centile, right? But we started our journey from 50th, right? So meaning thereby IUGR है ये. The reasons कि uterine arteries की जो RI और PI values है, they are high, and therefore it is a uteroplacental insufficiency, right? But then the umbilical artery flows are normal, right? So this is the umbilical artery PI and the umbilical artery RI respectively. So resistance of the umbilical artery is all normal, and then we're dealing with oligohydramnios, right? And then this is the placenta, and this is the placenta, and the placenta is all homogeneous. Then there was a thought of starting her with a low molecular weight heparin and an equaspirin. So on the second day we had this sort of a polypoidal lesion which changed the character on day 3. So day 3 it became something like this, and therefore it was sort of a very clear that we're dealing with some hematoma, right? So you look around in here, so it is evolving, this lesion is evolving the character. And then we, on day 4 and 5, we saw that this is a huge sort of a lesion, something around 70 ml at the inferior margin of the placenta at the level of the internal os. So this is that hematoma which has been formed because of these LMWH and equaspirin. And this is the weight, it is 1290 at the moment. And fractionated heparin has been known to create this HIT phenomenon. And LMWH we are using day in, day out, and we have had good experience of something around a decade and a half of using this low molecular weight heparin in all the high risk cases, right? And we have almost negligible is our that we could recall in the near future, that probably we never have had encountered this heparin induced thrombocytopenia with a low molecular weight heparin. So this is a very very typical case. So her platelets, since we had this sort of a polypoidal lesion and all those stuff, and then we changed the character, and therefore that raised our tentacles, and we looked on for the maternal platelets. So we really don't know what was the background when we did the ultrasound, but in the follow-up we identified that it was 1.3 lakhs, and then when it was on day 5, day 4, it was 90,000. It has gone down to 90,000 or so, and therefore it is. So even though, so the take-home message is this, that even though we identify that the safety profile of this LMWH is very good, but even though idiosyncratically they can really create some troubles, and therefore we can have an heparin-induced thrombocytopenia with this LMWH also. So we need to be very, very wary, and we need to keep a watchful eye so as to identify. 5% of the females, 5% of the people, they can be idiosyncratic to the equestrian also. So whenever this acetyl salicylic acid is being given, so probably we can ask for sneezing, or sort of, and if they do have a nasal polyps and all those stuff, so they can be sensitive to the ecosprin also, right? So that is how it is. Thank you very much for your patience.